I'm Christine Alongi, and I'm the director of the Strong Hearts Cardiac Rehab Program.
And I'm Dr. Amy Beard. I'm the medical director for intensive cardiac rehab and cardiac rehab.
Sorry.
And we're very happy to be here.
Hard. I started getting a little bit more nervous about my whole life and condition, and they suggested cardiac rehab. And also I was diagnosed with high cholesterol and pre-diabetic. And everybody in my family, when they got older, had high cholesterol and had to take medication and ended up going diabetic. So I was so happy that I had the opportunity to come to the cardiac rehab. So they've taught me how to get my life back into control. My sugar levels are back down to normal, no medication whatsoever. And I believe that my cholesterol levels are down as well, so no medication for that. And I feel stronger. I can go longer on the treadmill. I can go longer just walking around with my kids, my grandkids. I get to spend time with my grandkids, quality time that, every day counts. And I want to be proactive with this and take control of my life. And I believe that this program helps you to become back in control of your life.
Just one of the many wonderful things we get to hear from our patients. I always say our clinic, we're full of flowers and sunshine up there, because we get to see them post-procedure, after they're scared, and really kind of get to turn their life around, and like she said, get control over this disease thing and kind of start to feel better. So just a little bit about our clinic. We just opened up about 6 months ago. We're brand new, and we offer traditional cardiac rehab, and then we also offer a thing called intensive cardiac rehab, which is kind of new. It's the first, it's the only hospital-based intensive cardiac rehab in Central Arkansas. So cardiac rehab traditionally is 36 sessions of exercise. So this intensive thing, we partner with Pritikin. So we offer 36 sessions of exercise along with 36 education sessions. So the education consists of workshops, nutrition workshops led by our dietitian. We have mental health workshops that focus on stress reduction, depression. We have a slew of educational videos that they watch. And then we also have a kitchen, and we offer cooking demonstrations.
And these are some of the eligible diagnoses for both intensive cardiac rehab and just cardiac rehab. There is one exception, and that is for congestive heart failure with an ejection fraction of 35% or less. That is included in the cardiac rehab, not for the intensive cardiac rehab at this time. And there really is no time limit on these diagnoses, with the exception of an acute MI, and that has a time limit of 12 months. So you can refer your patients for any of these diagnoses. If they've had these in the past, go ahead and refer them to us. And we have seen people who've had cabbages. We see those typically 2 weeks post-op. If they've had a cardiac stent with a radial access, we can see those the next day. For a femoral access, we can see those the next week. And then also, right now, currently, Medicare is the only provider that is covering for intensive cardiac rehab. For cardiac rehab, it's Medicare plus the major players.
So what we do is when each patient comes to our center, we develop an individualized treatment plan, or an ITP. Their initial consult takes about 2 hours. We do a thorough medical history on them. We do an exercise tolerance test. We can accommodate pretty much any physical limitation that a patient might have. So we have arm ergometers, we have protocols we can do one on the new step, we can do one on the bike, even the treadmill, or even a 6-minute walk test that they can use their cane or their walker. And some even just push a wheelchair when they do the 6-minute walk test around our track. We do a PHQ-9 for depression, and if they score within a certain range, it's an automatic one-on-one consult to our mental health therapist. We assess where they are in that stage of change, where they are in their readiness for change, their current activity level, the rate your plate, kind of see how they're currently eating. And we do a basic knowledge test just on the disease and how all these lifestyle factors that we assess and that we work on, kind of where they are with that. And then we reassess these every 30 days so we can progress them through the program. Cardiac rehab, if you're not familiar, it's a span of typically 3 times a week over 12 to 18 weeks. So we're with these patients for a long haul, and we have a lot of opportunity to see a lot of change. So I always say we don't have to go organic and tofu overnight, right? We can gradually kind of chip away at some of these things and cut back on cigarettes or whatever it might be that we're working on. So this is our team I wanted to introduce. We have a team of experts. We have a culinary expert, our chef Mark. We have exercise physiologists, registered nurses, registered dietitians. We have a yoga instructor that works with this population. And then we also have, I'm missing somebody.
A counselor.
Oh, the mental health therapist.
Yes.
Yeah, the counselor. Thank you. So this is when you get off the elevator. We're located on the 4th floor of the Arkansas Heart Hospital Clinic. So we're across the street, about a block from the hospital, if you're not familiar with where we are. When you get off the elevator, you see our sign. We've kind of taken over that whole floor, plus with the surgeons. Then this is our front entrance. Like I said, we're flowers and sunshine. I think we have over 75 windows up there. We have beautiful views. When you walk in, it's floor-to-ceiling windows. It's bright. It's airy. It's a very motivating environment. The ladies greet every patient here. They know every patient by name. And a unique feature to our program is we allow their caregiver to come at no additional cost, and they can participate. So whether it's a spouse, if it's a child, they can exercise, attend the cooking demonstrations, watch the videos, do everything along with the patient. And this really facilitates like a whole environment change, and that's what we want. We don't want this to be cardiac rehab and then you leave and you go back to what you were doing. We really want them to change and prevent another procedure or event happening. So I wanted to introduce to you Mr. Copeland. This is him with his coach. We kind of case manage. So if one of the coaches, I have 2 registered nurses and 5 exercise physiologists, so we have 7 coaches total. We do a 1-to-4 ratio. Sometimes we'll have 5 patients per group, and we run 6 groups a day. So we can have 28 to 32 patients times 6 a day. So we can run a large volume through our clinic. So this is Mr. Copeland. He kind of came to us. He was post-MI. He had 2 stents. I was reading in his follow-up with his doc, he gained 10 pounds after the procedure. He was eating 1 large meal a day, typically in the evening. He lives alone. He has 1 son. He kind of helps to care for his elderly mother. He was like, I'll give this a try, but I live kind of far. You know, most of the patients, when they come to us, they've probably failed at a few lifestyle behavior modifications before, so they're not too confident, or too hopeful that they can do it. I think one of the successful things that we do is that one-on-one, that relationship that they develop. So the coach really gets to know them, gets to know their EKG rhythm, gets to know their heart rate, how their blood pressure responds, so they can really notice any changes or differences. So this is how he presented on his first day. You can see he has a pretty big medical history. His exercise tolerance test, he walked 1,090 feet. That was around our track. In 6 minutes is what he did. Lipids were out of control, and his weight and BMI were pretty high.
And he's a lot like many of our patients. They come to us, they're scared, they're anxious, they're apprehensive about their future because they've had this big event. And then you see this transformation occur kind of gradually, and they come in and they're smiling more, they're more talkative, they're engaged, they're making friends who have been through similar situations like them. And then they graduate, and you've seen this total transformation, and they leave more confident, empowered, and you feel like they've got a good grasp of what they should do when they leave. And oftentimes they don't want to, and we don't want them to leave, but they can come back in certain phases to continue at least the exercise part of things.
Yeah, they make like them little get-along gangs. Like we have 2 gentlemen, they're the Dos Equis, and now they're adding another guy, so they're going to be the Tres Equis. And they get in weight loss competitions, and then the little ladies sew little pouches to hold their little telemetry boxes with ribbons and stuff, and they're color coordinated when they come, so it gets to be pretty fun, yeah. So every patient exercises. Again, we can modify this. We can adjust it to any limitation they might have. So this is a big picture of our center. We have a lot of equipment. We rotate them through. Usually nobody stays on one piece of equipment. So they may do some of the arm bike, the rower, the bicycle, the treadmill. We try to transfer them, and then we try to get them functional to where we can increase their walk, and then we can get up and down off the ground and walk up hills and stuff, because we really want it to translate into that quality of life. We do weight training with them. Monday is kind of more of our resistance training day. We start every group with some resistance training. We have a beginner and an advanced group. The beginner group is sitting in chairs, typically bands, ankle weights, with all the sternal precautions because a lot are 2 weeks post-cabbage. And then we have our advanced where they're in there banging out the big dumbbells and stuff. And we get a lot of results where the guys are like, they like getting their upper body strength back. They really like feeling strong again. And you can see that our coaches are pretty buff, so they kind of like having their own trainer. So, and then we have a group exercise room. This is where we do that ugly 4-letter word called yoga. Our Southern boys don't really like it, so my Jedi mind trick, we call it balance and stretch. So they go to balance and stretch on Wednesdays. And then they go into their cardio.
They don't realize they're doing
Yeah,
yoga.
we don't tell them it's yoga. Yeah. So some sit in the chair, some stand up. You can see we have the bar that they can use for balance, and that's where we're really working on this. We try to really incorporate all of the components of the lifestyle behaviors that contribute to heart disease.
And they also, the instructor will also do a lot of meditation and stress reduction techniques for the patients. And I think this is very important. I think our patients kind of underestimate the amount of stress that is going on in their lives. And we know that incorporating stress reduction techniques into one's health plan is going to have positive effects on their health outcomes. And so I'm very pleased that we have this component in this program.
Yeah. And then we also, like I said, we partner with Pritikin. They provide all of our education for us. So the nutrition plan that we have, it's no calorie counting. It's pretty simple. We really try to eliminate all processed foods. It's a high intake of fruits, vegetables, whole grains, lean meats, and healthy fats. So it's pretty simple. We reduce some sodium in there. Like I said, our chef can really drive it home. So we teach them label reading. We teach them all about all the nutrients and the components. And then the chef drives it home on Fridays when we do the cooking demonstrations. This is our demo kitchen. So they're up there. We've kind of switched it around a little bit, which has helped. They get to try it when they come in. They kind of fix their little sample and sit down, and then he shows them how he's preparing it. So then they can ask him as they're going along, well, could I add some more garlic here? Or could I add this? And it's really kind of helped them engage even more in the cooking demonstrations. And like I said, we do cooking demos on Friday. It's our biggest days. That's where all the spouses come. So this is Kobe. He's one of the chefs. And then Chef Mark is actually our full-time chef. And he has a great testimony. He had some heart issues, and he kind of adopted the whole lifestyle. So when he's lost weight, he's off all his medications. He doesn't have any edema anymore. So he's a great inspiration for all of them. And he's very, very creative. Side note, we have some of the sodium-free spice blends out there on our table. So please feel free to grab some on your way out. So then we also have a healthy minds component. So like we said, it's stress reduction and the depression. So we bring in a mental health therapist. The depression is rampant, like you all know, post-procedure especially. So he does these sessions. So at first, they're like, we don't need therapy. We're not going to counseling. But they really open up. And then they start realizing everybody's kind of going through the same thing. And like I said, we have 6 groups. So once they start meeting and talking and sharing their stories, those groups really bond. And I think it really helps with that recovery. And we see every 30 days, those depression scores actually increase, or get better, I should say, improve. And then we do have limitations in our assessment. Like if they score a certain score, like I said, it's automatic one-on-one consult with him. We offer it. Not all want to participate.
But most take
do.
part of that.
Mm-hmm. Mm-hmm. And then, like I said, it's more stress reduction. So then this is Mr. Copeland. 12 weeks later, he lost 34 pounds. He dropped his BMI by 4. His waist circumference went down 7 inches. He is totally sold in. He wants to be our spokesperson. He wants to go out and everybody. He's like, you got me. I'm 100% bought in. He prepares his own food now. He has his mother eating the food. He says he has purpose again. He has energy. He keeps up with his son and his grandson. He's like, loves it. And it's so amazing because he drove over an hour to come to us 2 to 3 times a week over the 12 weeks. This is the first time he had a normal lipid panel, too, in 5 years. So he really turned it around.
It works.
It works, yeah. Yeah. And this is just a few more of just the thank you notes. Again, I feel very honored and fortunate to be able to be up there because we really see the turnaround in them. And just to have the opportunity, we get these almost daily when the patients graduate, when they finish all of their sessions. We do offer phase 3, like Dr. Beard had said, so it's called the maintenance phase, where they can still continue to come and exercise with us. And a lot of them do. They still come to our center, so they continue. We don't hook them up to the EKGs anymore, but we're still there to check a blood sugar, a blood pressure, or to help them as needed. So, and then when everybody graduates, we kind of make it a big deal. We read off their achievements, they walk a red carpet, they sign their name on the gong and bang the gong. They get a t-shirt or a certificate.
Yes.